Hi guys, my name is Rochelle Dat and welcome to today's teaching session on transition to fatherhood, recognizing a sick newborn. So let's get into it and have a look at our learning objectives. Today we'll be covering signs of illness in a neonate, basic infant resuscitation, and where to seek medical attention. For a newborn, the outside world is a foreign environment, and this can be a massive adjustment period. When bringing your newborn home, there is no manual guide given to you on how to recognize the early signs of illness. Also at this stage, you'll be learning the normal behaviors of your baby. And you'll be asking yourself, how will I know when my baby is sick? There are roughly 8 main signs of illness in a newborn, and they are fever, jaundice, certain rashes, nausea and vomiting, constipation and diarrhea, difficulty breathing, non-stop crying, and weight loss. Once you are able to recognize these signs and symptoms, then you can be confident enough to seek medical attention. Adults are able to control their body temperature and maintain it at a regular level with their own biological thermostat. When an adult's core body temperature begins to rise, the autonomic nervous system stimulates sweat glands, which causes the adult to perspire, thus cooling the body. Furthermore, when an adult's body temperature begins to drop, causing them to become cold, their body begins to shiver, which facilitates the rise in body temperature. However, newborns have not entirely developed these mechanisms and therefore are at greater risk of overheating or developing hypothermia. The average body temperature for a baby is between 36.5 to 37.9 degrees Celsius. Any temperature higher than 38 degrees Celsius requires action. There are usually 3 reasons why your baby may have a temperature, and these are infection, overheating, or dehydration. Early signs of infection are discharge, odor, bleeding, or vomit that is greenish or yellowish in color, and this requires medical attention. It is very easy to overheat your baby. The general mistake parents tend to make is overdressing or applying too many layers. Signs your baby is overheating is restlessness and having a flushed face, which is red and hot. To prevent overheating, dress your baby as you would yourself and try keeping the room temperature between 22.2 to 24 degrees Celsius. Lastly, dehydration or low fluid intake can cause serious harm to your baby. Not enough fluid can cause your baby's body temperature to rise. Dehydration is usually seen in babies who are 2 to 3 days old, as this is the period where mothers are trying to establish breastfeeding. To gauge a close to accurate temperature of your baby, use a digital thermometer under their armpit. For safety reasons, never use a mercury thermometer. Jaundice. Approximately 60% of newborns experience jaundice. It can appear 3 days after birth. Jaundice is typically harmless and resolves after 1 to 2 weeks when treated. Babies are born with a lot of red blood cells. When these cells break down, they release a chemical called bilirubin. Due to the fact that a baby's liver is not fully developed enough to absorb the bilirubin, this causes an overload, which thus leads to jaundice. This affects the baby's skin and the whites of their eyes to characteristically become yellow in color. It stereotypically starts from the face and works its way down to the body and feet. Aside from the yellowing, other symptoms of concern are sleepiness or hard to arouse or feeds, no bowel motions for 48 hours, and decreased wet nappies throughout the day. Your baby's output must be closely monitored. Indications of severe jaundice are pale stools, dark urines, and fewer than 6 nappies per day. The treatment of jaundice depends on the severity. Babies should be closely monitored for several days. For mild jaundice, regular breastfeeding or formula feeding should be maintained, and exposing your baby to indirect sunlight whilst just wearing a singlet and nappy should help the breakdown of bilirubin. For severe cases, phototherapy may be more effective. This requires the baby to be exposed to ultraviolet light to help the breakdown of bilirubin. Rashes. Many infant rashes are harmless. However, if your baby's rashes are non-blanching or accompany swollen glands, high temperatures, or cough and cold symptoms, then you must seek medical attention. Common severe rashes are chickenpox, scarlet fever, measles, psoriasis, and meningitis. Effective ways to avoid your baby from being exposed to these rashes are to stay up to date with their immunization schedules and monitoring your baby's contact with other children or adults who have not been properly vaccinated. Nausea and vomiting. The occasional spit up or regurgitation is completely normal for a newborn baby. In most cases, this should rarely continue further than a few feeds. However, if small vomits become more frequent, projectile in force, and also your baby is unable to hold liquids for more than 8 hours, then you need to seek medical assistance. Causes of nausea and vomiting can be food intolerances, medication, motion sickness, and gastritis. When assessing your baby's vomit, look out for signs of blood or bile. This may suggest your baby has indigested blood or may have a bowel obstruction. Treatments are increase your baby's fluid intake and seek medical attention. Excessive nausea and vomiting can cause dehydration and hospitalization. Constipation and diarrhea. What is constipation and diarrhea? Well, both entail the regularity, consistency, frequency, color, and efficiency of how your newborn is able to pass a bowel motion. Many parents perceive constipation as their baby unable to pass a bowel motion on a regular basis. However, constipation occurs when the baby has difficulty passing a bowel motion, causing pain or bleeding. Signs of constipation are hard abdomens, irritability, if your baby groans or strains when passing a motion, and smelly farts. Causes of constipation can be due to decreased fluid intake or ill preparation of formula. Solutions to constipation is to increase fluid intake, gentle massage of the tummy, and warm baths to relax the abdominal muscles. You can also try stimulating your baby's bowels by moving their legs around in a circular motion. Diarrhea, on the other hand, is when your baby passes very runny or liquidy bowel motions. The cause of diarrhea is often a viral or bacterial infection and commonly associated with vomiting. In a newborn, diarrhea can be very serious. A newborn can become easily dehydrated. Therefore, this is important to contact your doctor if your baby continues to have watery stools for 24 hours. Once again, the treatment of diarrhea is dependent on the cause. Sometimes what is needed is a change of formula, electrolyte replacement between feeds, or medication. However, it is advised to never give your baby new medications unless prescribed by a doctor. Breathing difficulties. The lungs are one of the major organs that are the last to fully develop in a newborn. Therefore, infants can have many breathing difficulties. Newborns have a much faster breathing rate compared to adults. A newborn's breathing pattern is called periodic breathing. Characteristically, a newborn can take 30 to 60 breaths per minute, then can slow down to 20 times per minute while at rest. Newborns also have a tendency to breathe rapidly and then hold their breath for up to 10 seconds. This is a normal breathing pattern, however, it can still alarm new parents. Infants are nostril breathers, have smaller airways and rely heavily on their muscles between their ribs to help them breathe. This consequently makes them highly susceptible to nasal congestion and obstruction. Sounds that may indicate that your newborn is having difficulty breathing are wheezing, deep cough, whistling, grunting, stridor, snoring, or fast breathing. The physiological indications that your baby is having difficulty are nasal flaring, blue colouring, the use of their stomach and rib muscles, and the use of part of their chest muscles. Difficulty breathing causes an immediate medical attention. Non-stop crying. Crying is a typical behaviour for a newborn. Common reasons why a baby would cry are for a nappy change, hunger, wind, cold or hot, or just for comfort. However, if you find that your baby's patterns have changed without any reason and have beginning to sound differently, such as shrieking or screaming, this will warrant immediate medical attention. Weight loss. All babies grow differently as they age. In the early days post-birth, there is a normal amount of weight lost by your baby. As a general guideline, a baby can lose up to 7 to 10% of their body weight in the first week and typically regain it again 2 weeks post-birth. Characteristically, a baby's weight from birth should have typically doubled at the 4 months mark and tripled by the time they are 13 or 15 months old. Keep in mind that this is just a guideline and can dramatically differ due to ethnicity, gestation at birth, medical conditions, and dietary intake. The average amount of feeds your baby should be having over a 24-hour period is 8 to 12 times for a standard weight gain to occur. If you are worried about your baby's weight gain, it would be a good decision to take your baby to the nearest general practitioner or child health clinic, where they are able to weigh and assess your baby's growth. Now we go on to basic infant resuscitation. It is important as a parent to know basic life support and first aid. The health of a newborn can go down very fast, and knowing the steps to take will be very beneficial for your child. First aid is given to your newborn who is suffering from an illness or injury. With providing the appropriate care, you may be able to promote recovery or prevent the condition from worsening before being able to seek medical attention. Knowing first aid can be useful in a range of situations such as cuts and abrasions, burns, falls, broken bones, unconsciousness, asthma attacks, drownings, and poisonings. It is important to have a first aid kit on hand if these unforeseen events were to occur. A first aid kit contains basic household items that are able to treat common injuries, and these include safety equipment such as disposable gloves, materials like bandages and tapes, scissors and tweezers, a thermal blanket, and lastly, medication such as antiseptic. You are able to buy these ready-made kits from organizations such as the Red Cross and St. George Ambulance. Keep your first aid kit dry and out of reach of children. CPR. If your baby's health is worsening and simple first aid treatment does not work to help the situation, then it is important to know CPR to keep your newborn alive until medical assistance arrives. This is easily remembered by the acronym Doctors ABC. This stands for Danger, Response, Send for Help, Airways, Breathing, Cardiopulmonary Resuscitation, and lastly, Defibrillation. And this can help save your baby's life. Here are some instructions regarding CPR. First, clear the airways. If your baby is unconscious, check for any obstructions in their mouth. For example, food, toys, vomit, or even their tongue. To clear away this obstruction, place your baby on their back and use your little finger to open up their airways. Step 2, check for breathing. Place the side of your cheek just above their nose whilst looking down at their stomach. This allows you to listen and feel for breaths against your cheek and see the movement of their chest rise and fall. Step 3, If your baby is breathing, place him or her in the recovery position by laying them face down on your forearm. Call 000 and monitor your baby's breathing until ambulance arrive. If your baby is not breathing, immediately call 000 and commence CPR. Use 2 fingers positioned in the center of their chest and give 30 compressions at the rate of 100 compressions per minute. Each depth of compression should be at least 1/3 of your baby's chest. Place your mouth over your baby's mouth and create a tight seal. Blow gently for around 1 second and watch the rise and fall of their chest while you deliver each breath. Continue to deliver 30 compressions by 2 breaths until medical assistance arrives. If you are unsure on your baby's condition, here is some more information to remember and where to seek help. If you seek immediate medical attention, call 000 for an ambulance. Or if you are unsure of the seriousness of your newborn's condition, contact Poisons Information, Health Direct, 13 Health, or Parent Line to speak to a nurse for free advice. Furthermore, to check your baby's immunization schedule, visit www.immunization.health.gov.au. In conclusion, recapping on the information learnt, the main points to remember is that newborns can be very resilient. However, when they do fall ill, this may require serious medical assistance. It is important to be able to recognize when your newborn is sick and how to take action. Signs of illness can be temperatures above 38 degrees Celsius, signs of infection, yellowing of the skin, non-blanching rashes, dehydration, decreased wet nappies, and your baby not waking up for feeds. Call 000 when you are unsure, and lastly, stay on top of your first aid, as it may save a life. Thank you for listening.